ask me all I need to know. You can be my one and only. There's a lot of pretty girls in this city. There's a lot of pretty. What you know about rolling down in the
So, good day everyone. I, Shirley Maneja, I'm going to talk about pregnancy. So, pregnancy refers to the period in which a fetus develops inside a woman's womb or uterus. A pregnancy usually lasts about 40 weeks or a little over 9 months. From the last menstrual cycle through delivery. During pregnancy, there are significant hormonal changes. This can cause a wide range of symptoms. Some women experience a lot of pregnancy symptoms, while others just have a few. Missed period, breast changes, fatigue, frequent urination, nose, and vomiting are all signs of pregnancy. However, these symptoms could be caused by other things and don't always signal you're pregnant. So, if you're worried, take a home pregnancy test and contact your doctor. Backache, headache, leg cramps, or varicose veins, itch or tingling, constipation, hemorrhoids or indigestion, vaginitis or vaginal discharge, mood changes that might occur in later stages of pregnancy. One of the most important concerns confronting today's Filipino youth is early pregnancy. Pregnancy in females under the age of 20 is known as teen pregnancy. Teenagers are between the ages of 13 and 20, and while they aren't quite children, they aren't quite adults either, putting them at greater risk during this period of confusion. Teenagers are compelled to examine their bodies as their sexual development progresses. They frequently engage in dangerous intercourse due to a lack of sex awareness. Eventually, becoming adolescent parents, the dangers and realities of teenage parenthood have been widely documented, with ramifications beginning with childbirth and lasting for both mother and child throughout their lives. Teenage births have a health consequences. Infants are more likely to be born preterm, have a lower birth weight, and have a higher neonatal mortality rate, while moms are less likely to start breastfeeding. Teenage moms are less likely to finish high school, are more likely to live life in poverty, and have children with health and developmental issues. Understanding the risk factors for teenage pregnancy is essential to lowering teenage motherhood rates. Teenage pregnancy is influenced by a number of social and biological factors, including trauma during childhood and adolescence, a family history of teenage pregnancy, conduct and attention issues, family instability, and low educational attainment. So the effect of teenage pregnancy in society. Early childbirth may have negative health consequences and pose a risk to the country's economic prosperity. Pregnant teenagers are less likely to complete higher education and have a lower lifetime earning potential, resulting in economic cost for the country according to the Philippine Statistics Authorities or PSA National Demographic and Health Surveys or NBHS 2017. The percentage of young women who have started childbearing is lower in urban areas than in rural areas, 7% versus 10%. Young women with only a primary education and those from low-income families are more likely to have started having children than young women with higher education levels and those from better income families. So the conclusion about pregnancy. It is well recognized that adolescent girls who become pregnant suffer significant medical risk if the pregnancy is carried to term. We also know that teen mothers and their children have a lower chance of succeeding in life. Furthermore, children of adolescent mothers are more likely to become teenage moms themselves, prolonging the intergenerational cycle of teen pregnancy. With these effects in mind, we should strive to limit the number of teenage pregnancies, particularly undesired and unexpected pregnancies. We hypothesize from the outset that there are characteristics in early life that can predict teenage pregnancy. This has been validated by our findings and knowledge of these predicted indicators should be used to inform future policy actions. Our findings imply that in addition to the usual focus on sex, education programs, initiatives to reduce adolescent pregnancy rates could address additional factors. Early intervention to correct behavioral problems, in particular, could help to reduce the number of unplanned teenage pregnancies. So, adolescent pregnancy is a worldwide issue, although it is more prevalent in poor and marginalized groups. Many young females are put under a lot of pressure to marry and have a children while they are still young. When girls are denied the freedom to make decisions about their sexual and reproductive health and well-being, teen pregnancy rates rise. Girls must be able to make decisions about their bodies and futures on their own, as well as having access to proper health care and education. Teenage pregnancies are linked to social issues such as lower educational levels and poverty. Teenage pregnancy in developed countries occurs outside of marriage and is often associated with social stigma. When used together, educational programs and birth control access can help to minimize unwanted teen pregnancies.
Tried so hard and got so far, but in the end, it doesn't even matter.